Good morning, everyone. I know your National Examination Board for Dental Nurses Workbook Part exam is coming up, and I just want to ensure you that there is nothing for you to worry about. All imagery and scenarios here are made up by myself, and there is no chance that you would get the same questions as in my made up scenarios. And it's made purely for illustrative purposes to ensure that there is nothing to be afraid of when your workbook comes. So, as far as I remember, there are 7 stations. One of those stations might or might not contain a medical emergency, where you would need to select the steps. How would you approach the medical emergency? And all rest of the stations would be some sort of scenario where you would need to select correct selection of instruments, materials, mixing medicines like ozonol, dicals. So remember, you're doing those every day, and there is nothing to be worried about. But if you're going back to medical emergencies, this tab I made a couple of years ago when I was revising for my workbook part. And here I wrote down a medical emergency and why medical emergency occurs, what are the signs and symptoms, what would we do, and what emergency drug would be given. You can make a screenshot of this if you feel that it's useful for you, but it was very useful for me back then. Okay, so as I said, all my stations are purely made up, but it could look something like this. We drop down boxes yes and no. In total, there could be around 180-ish something like questions, but actually they are not questions as per se. They are just those pictures you need to select. So, for example, in this scenario, today you have patient attending for apioectomy, oral surgery, a part of local anesthetic and curved oral surgery instruments. Which one is the only instrument that protects nerves during apioectomy? So remember, you would say no, 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 all those who doesn't apply, and then you would select yes, and every correct no is a point, and correct yes is a point. So look how many points you could get. But it's not limited just for 10 pictures. They could give you 20, 30 pictures within that one station, and that already would be like 30 points, for example. So there I wrote like elevators, the names of them, and then this is the correct answer, which would be periosteal elevator, because it's the only one instrument that protects nerve. I'm so sorry, I have chest infection right now. And then I made purely for educational purposes, just a radiography, because I always been told that it's good to know the faults, even though we don't use the old style anymore. So, for example, I made a scenario. Today you are developing some X-ray films for patient. You notice developer splash on one X-ray film and static error on another. Which image indicates developer splash and static error on X-ray. And it again would be yes or no drop-down boxes where you would simply choose which applies for your question. So let's look at the answers. So you can make screenshot of this if you feel it could be beneficial for you. And the correct answer would be developer splash dark color and fixer splash white color. So let me find. So this is the white color and this is the dark color. Remember, everything is there already that you know. It could be anything really. Root canal first or second stage, extraction. It could be a amalgam or compostive restorative fillings, mixing materials. And remember, if it's restorative filling, in our Levison textbook for dental nurses, it says us that when it's restorative filling, we always must use rubber dam to to isolate oral cavity from any debris or liquids entering. So if you come up with a scenario about restorative filling and they show a picture of rubber dam, be confident, select rubber dam as well to earn points. And yeah, don't overthink too much, as workbook is all about understanding your knowledge about um, instruments, materials, and don't overthink too much. Make sure that you recognize your instruments and you know the correct selection. For example, if you need to select also the needle length um, for the procedure, remember infiltration, all upper teeth, maxillary arch infiltration, it could be labial and palatal or buccal palatal. And then mandibular arch, which is lower arch, posterior teeth 8, 7, and 6 is ID block with a long needle, and anterior teeth are infiltration, which is labial and lingual, and with a short needle. However, there could be that once ID block is given, the dentist might say, okay, I want to do infiltration, just a small top up around the tooth with a short needle. So revise these little small things because they do matter in the end. Make sure you know your ratios when you are mixing cements and any other mixing medicaments. Make sure you know in which cases you would use them. When do you use dicol? When you use calcinol? When you use any other mixing material? So it's really about to see if you truly understand um, the reason why we mix ratio 1 to 1, or understand the reason why you need to select particular instruments for that procedure. Don't worry too much. You'll see once you pass your workbook part, you will be very relieved because you will realize that there was nothing really too scary. So I wish you all best of the luck, and I hope you will have nice, easy stations to go through, and you will feel confident in selecting those instruments and materials. And please let me know if this was useful for you, and if you have any other questions or any other video you would be interested for me to make. Okay, for now I'm just saying goodbye, and I wish you best of the luck in your upcoming workbook exam. Bye.